Hi, my name is Paul. I'm one of the physician assistants here in the emergency room at Goodland Regional Medical Center, and I'm here to talk to you about the COVID-19 virus that's currently affecting the U.S. as well as the rest of the world. As many of you know, this has been an emerging public health issue, and we want to talk about things that we need to be concerned about and things that we don't need to be concerned about today. And I have one of my colleagues with me here as well.
Hey guys, my name is Cassie Gray. I'm a registered nurse here at Goodland Regional Medical Center, and I'm also the infection control coordinator here for the hospital. So we wanted to talk to you guys about the COVID-19, but also really respiratory illnesses in general. The flu is something that's going around just as heavily here in our community. So some ways that you can protect yourself from respiratory illnesses are practicing good hand hygiene, washing your hands with soap and water for at least 20 seconds, or using alcohol-based hand sanitizer is a really good method. Sometimes that you should be washing your hands after things like blowing your nose, coughing, sneezing, or touching high traffic surfaces like doorknobs, light switches, in desks or shopping carts. It's important to avoid touching your face, eyes, and nose, especially if you are out in the community and touching those high-touch surfaces. It's important to practice good respiratory hygiene, like covering your cough, throwing away your tissues after you're using them, and then also washing your hands. So some other things that you can do to help keep you and your loved ones safe is just practicing routine cleaning in your home, especially for those high-touch surfaces like doorknobs, light switches, the bathrooms, and things like your phone. Make sure that you are staying home if you're ill, and remember to keep your children home from school or daycare as well if they're sick. If you are experiencing respiratory illness symptoms or you're needing to seek medical care, we're asking that you please call ahead to your physician's office before coming in order to get further instructions. If you come into the clinic or the hospital, we ask that you do please put a mask on. So Paul, I'll let you talk about respiratory illness symptoms and your experience.
Absolutely, thanks. COVID-19 is what we're most concerned with, but as Cassie already pointed out, there's many respiratory illnesses going through the community that are standard for this time of year, which include the flu. So the recommendations we're giving you are for all of them and not just COVID-19. But in regards to COVID-19, it's caused by a coronavirus, which is a virus that causes many types of respiratory illnesses. At this time, there's nothing that makes us think that we need to be overly concerned. We just need to take appropriate action with regards to this. These are simple measures that we can take that Cassie already pointed out. Good hygiene, hand washing, staying home from work or from school if you're sick. And if you do need to seek medical care, contact your provider before you come in. Most patients that we've seen with COVID-19, in fact, don't have symptoms or only have minimal symptoms. Most people are doing just fine with it and recovering well without anything more than the typical treatment you would do for the standard cold: rest, hydration, eating well, ibuprofen or Tylenol used for fever and aches, and other over-the-counter cold medications. It's only a small percentage that are becoming overly sick with it, and these are the people that are normally at risk from respiratory illnesses. People we're most worried about are those who have comorbidities, or things that would put them at higher risk from having complications from COVID-19. People who are older in age, people who have underlying medical conditions such as cardiovascular disease or COPD, asthma. And these are the people we want to pay particular attention to when it comes to complications. Still, they will do just fine as long as they follow good hygiene efforts. They stay home when they're sick, they avoid sick contacts while we let this pass. Overall, I'm not particularly worried about it, Cassie, as long as we all just do what we need to do to keep ourselves healthy and safe from respiratory illnesses, whether it's COVID-19, influenza, or any of the other ones that we deal with on a day-to-day and year-to-year basis.
Sounds good. If you do have any questions or concerns, feel free to reach out to the Sherman County Health Department. Their phone number is 785-890-4888, or you can go online to the KDHE website. They have a lot of information and they do update that daily. The CDC website also updates their information daily as well. So thank you so much for taking your time to listen to us, and if you have any questions, please don't hesitate to ask.